a fever or flu-like symptoms and you want to know when it's appropriate to stay home and when to go to the urgent care, you and I know that sometimes you go to the urgent care and all they tell you is to do supportive care and you have wasted money and time over there. So on today's video, I am going to break down certain symptoms that require that you go to the urgent care and also certain symptoms that require that you stay home and treat yourself symptomatically because the symptoms will go away on their own. Now let's dive into it. Not all fever needs urgent care attention and not all flu-like symptoms need for you to go to the urgent care. So if you have a fever of less than 102 degrees Fahrenheit and you don't have any severe symptoms, and you don't have severe symptoms, I mean shortness of breath, coughing up blood, chest pain, being confused, then and your symptoms are lasting less than 5 days, then you don't need to go to the urgent care. You can treat yourself symptomatically by taking either Tylenol, for your fever or bodily aches. If you want to take ibuprofen, be very careful because ibuprofen can affect your kidneys, and so you want to make sure that you are drinking plenty of water and you don't take it on an empty stomach. So if again fever less than 102 degrees, you don't have shortness of breath, no chest pain, no neck pain, no severe facial pain, and it's less than 5 days, or you see that the fever will start going away and the flu-like symptoms will start going away by day 5, you're getting better. So you don't have to go to the urgent care because you'll be wasting your time and money, because when you go there, they will always tell you to treat it symptomatically. So these symptoms will go away within 3 to 5 days. You see the curve going down. Okay, so you are getting better, so you don't need to go there. Now, however, if your symptoms has prolonged for over 10 days, then you are getting into the zone of a bacterial infection, especially if you have facial pain, sinus pain, postnasal drip, and you have this drips coming from your nose that is not improving over 10 days, then it's no longer viral. At this point, I think that you've done your best to treat it over the counter. It's not working. So at this point, I think it's appropriate to go to the emergency department. Now, what about if you have a fever of over 103 degrees? Any fever over 103 degrees Fahrenheit, which has lasted for more than 3 days or more, that is very serious, especially if you have neck pain, you have facial pain, headache associated with it, you are coughing blood, shortness of breath, take a deep breath, it hurts your chest. That means you have a serious infection. This is could be a bacterial infection, it could have a sinus infection, it could have a pneumonia, you could have meningitis. So if any fever, rule of thumb, any fever 103 degrees Fahrenheit over 3 or more days, it's a trip to the urgent care because that is not just viral. Okay, pay attention to this. Now, a special case, infants less than 3 months old, if they have a fever of 100.4 degrees Fahrenheit, that is a life-threatening emergency. Don't call virtual care. Don't go to the urgent care. Go to the ER immediately because your child could have a life-threatening condition. Children less than 3 months old, fever 100.4 degrees Fahrenheit, life-threatening emergency. Go to the ER immediately. Very, very important to do that. Special cases, people who are immune suppressed, they have chronic illness like COPD, asthma, congestive heart failure, diabetes. If you have a fever of 102 degrees, that is considered is a concern. Or if you just traveled or you are in contact with somebody who has been sick recently and you have any fever of that level, you go to the urgent care and be seen immediately. Now, if you had a contact with somebody who had a flu or COVID, and the person has a confirmed diagnosis of flu, COVID, or even strep throat, right, that's been confirmed. Remember, it must be confirmed. The person has a confirmed diagnosis. They did a test that was proving that it had either the flu or the COVID or the strep throat. If you have any of this and you're in contact with people like that and you have a fever with associated symptoms, then you have two options. These days, they have home kits that you can test yourself, do a throat swab, you can test if it's positive for a strep, or if it's a positive for flu or the COVID, they have these kits that you can buy in most pharmacies and you can check yourself. If you do check yourself and it's positive, you have two options. One, you can do a virtual care. These days, there are virtual cares all over, especially in the United States. The virtual care everywhere. You can do a virtual care. You show them the test results that is positive, and then the doctor can prescribe either Tamiflu for you if it's within 48 hours of the window when you have the symptom, within 48 hours of onset of symptoms. Or if you have a COVID and it is within 5 days of onset of symptoms, and you don't have severe symptoms, right? Severe symptoms, I mean shortness of breath, chest pain, oxygen level going down, dizziness. Those are severe symptoms. You should go to the ER. But if you don't have any of those severe symptoms, you can do a virtual care and your physician will prescribe Paxlovid for you if you qualify for it and you don't have any contraindication to it. So these are situations where you can decide whether you can do a virtual care or go to urgent care. Now, if there is no virtual care, then you should go to the ER. So the physician, not the ER, but urgent care. And the reason to go there is that your physician can prescribe antiviral for you, or they can test you if you are in touch with somebody who had any of these, diseases like pertussis, whooping cough, strep throat, COVID, influenza. Then they can test you, and if you're positive, they'll prescribe the appropriate antiviral or antibiotics for you. So these are some of the special situations that you can either stay home or you can go to urgent care. So not all fever and flu-like symptoms require you go to urgent care to waste money. So I hope today I was able to educate you on some of the things that require urgent care and the ones that you can just treat at home. Otherwise, some of the things that you can treat at home, I see people come to urgent care, they waste money and time, but they can treat this at home because they come in and all we tell them is that treat this symptomatically. So that's why I'm educating you today, so that the next time you have symptoms, decide if you fall within a category to go to urgent care or to stay at home and treat yourself. So if this video has been helpful to you, I want you to subscribe to my channel right away, because what I'm doing for you is that I'm saving you money and time by bringing you tips of urgent care common cases. So share this video, leave a comment, and if this has been helpful to you, and come back again for another tip. Until then, Dr. Moses.